Dr. Henderzaw is my OB, and he has been for 3 to 4 years. If I had to pick some of my favorite people in the world, he would be on that list. He made sure that I could come in and do early ultrasounds with Alton, and just kind of called me personally to make sure that I was okay and see how I was handling everything. But pretty much I couldn't ask for a better doctor. They found some abnormalities in the baby's abdomen, and they sent those off to Dr. Henderzaw, and he could tell I was really stressed out about it, that I was really anxious, and he went ahead and made a phone call and got us into maternal-fetal medicine about a week and a half sooner than what they were going to be able to see us. Our first appointment with maternal-fetal medicine, we did a scan, found out what the condition actually was, which they diagnosed it as bladder outlet obstruction. And at that gestational age, he was only supposed to weigh about 3.5 ounces, and they removed just over 3.5 ounces of fluid from his bladder. We had about 25 or 26, I think, appointments with maternal-fetal medicine, because we saw them at least once a week from the time we found it at 15 weeks. From our first appointment, they did their very best to keep us calm and give us straight shooters, stick with the facts, but also not make us feel too scared about what was happening, even though it was a really scary diagnosis. We had a fetal care conference at Riley, and that was just to kind of get everyone together and on the same page. I just had a lot more peace because I knew that there was at least some plan in the works, even though we didn't know what the outcome was going to be. And Dr. Henderzaw did tell me, even though he wasn't going to be there, and even though he wasn't going to deliver my son, I was still in really good hands. So he made sure to reassure me that I was in good hands no matter what. After Alton was born, he actually got to stay with me for 2 days, just so that way I could be with him, because I wasn't going to be able to leave for 24 hours. Alton had surgery at 3 days old and 2 weeks old, and there's been a lot of follow-up from that first surgery. We do have a pediatrician at Community, Dr. Greenfield. She is wonderful and has been great keeping up with all of his specialists, and they've all kept her kind of in the loop of what's going on. Yeah, things are going so well. I don't know if I touched on this, but it wasn't really expected that he was going to make it out of utero. He didn't have very high chances of that, and then if he did, we were looking at having to go to another children's hospital to do a surgery in utero. And then it was a question of if he was even going to make it to term. So if he was doing so well, but we were still probably going to have a very small preemie baby. But then he just kept on defying the odds, and it's a roller coaster. There, through all of the heartache and all of the scariness and the unknowns, the care that we received and the love that we got, and just we were covered in it, and it is overwhelmingly amazing. Makes us so thankful, and we know that we are so blessed and that we are very lucky that it turned out the way it did, but just overwhelmed. Every time I look at him, he's just like a little miracle.